Thank you so much. I'm Eric Wagner. I am Senior Director on the industry team. I lead provider strategy globally for Salesforce. I really would like to thank each and every one of you for attending. I know it's late in the day. Hope you've had a great session. I would first like to acknowledge that my clicker isn't working. There we go. I'd like to acknowledge the original owners of these land, the Gadigal people of the Aurora Nation, and honor the leaders past, present, and emerging. So, forward-looking statement: as a publicly traded company, please make any purchasing decisions based on what's readily available in the software today. We're in healthcare. Thank each and every one of you for all of the hard work that you do to make people's lives, family members, patients, children, elderly. You do an amazing job coming to work each day and trying to make things better for everyone involved. And I deeply, deeply thank each and every one of you. So, we're in the fourth industrial revolution. In case you haven't heard that 5 or 10 times today, you're going to hear it again. Data, data, data. What are we going to do with the data? How are we going to leverage this data? How are we going to connect with patients? How are we going to connect with employees, providers, when we have all of this data? It's challenging, right? It's immense. And then how we can improve outcomes leveraging this data. But what we want to do and what we want to talk about is changing the mindset. And if there's any providers and actual MDs in the audience, I apologize. But it's time to put the patient and the person at the center of what we do. Whether that's a member, whether that's a customer, whether that's a patient, we need to think about what that person is looking for. They need to be connected. They will need to have systems that understand and can engage them so that we can take them through the proper journeys as they're weaving through the halls and the processes of a very, very complicated and sometimes very dangerous time in their lives, and critical, of course, right? So how can we do these things, and what are we going to do these things? So, from a business perspective, we're looking for things that are scalable, things that we can take to market that are not going to kind of break internal systems, that are going to meet regulatory requirements. We want to make sure that we've got control over those systems. And we want to make sure that, of course, we trust those systems, right? So we all know that there was a 22% opt-out of My Health Record, right? There's a big trust issue in healthcare, and again, understandably so. But what we need to be able to do is take these things and turn them into assets, right? And give the people what they need, which is something that's personalized, something they can use to collaborate, and again, be connected, whether that's to a family member across the country, from Perth to Queensland, whether that's connecting just across town to your provider or care team. These are things that we expect in our everyday lives, right? You don't get on a plane without getting updates from Qantas that your flight's 5 minutes delayed or 30 minutes delayed, or that it's time to check in. Why can't we do these easy reminders and these things in healthcare? Well, again, we have the ability to do this with the patient success platform, the member success platform, and the consumer success platform. And really what we do is we've got the ability to link these challenges to bridge the gap between the issues that we're having from the expectations that these people are bringing into our facilities, and again, make sure that IT and the facilities are comfortable in that engagement and everything is happening. So as I said, it's the patient success platform, it's the member success platform, the customer success platform. And how we do this is with the Salesforce system. We take pre-built solutions that are highly customizable to be able to fix workflows, to reach outside of the walls of the institutions that we work in, start members and patients on the right journeys so they're understanding and more educated before they walk through the walls of the facility. They've got a better education. They have a better understanding of, again, a very critical time that could be happening. And again, leveraging this platform so that we can take integration from a MuleSoft perspective, tie all of this together from these siloed systems and bring things together in one layer that sits above these systems in a system of engagement that really is going to take healthcare into the new era. We've got an incredible partner ecosystem. Again, Salesforce has a very, very large Ohana. We can't do it all ourselves. And we've got partners like Live Data that's completely written a surgery perioperative suite management to completely run a surgery center on the Salesforce platform. We have marketing tools to be able to geofence departments within organizations so that you can read and interpret social media interaction real time, and then again make that that information addressable so you can actually take action on those events, whether someone's happy or not happy, right? So it's an incredible ecosystem built on this platform to extend and go deep within these facilities and really help solve the problems that we're facing in healthcare. And there's plenty of trailblazers from med device, pharma, payer and provider globally. We've got some tremendous success here, of course, in Australia and New Zealand with St. John of God, Opal Aged Care, the government of New Zealand and the bowel screening program. There's some really, really exciting things that are happening from a Salesforce perspective. And I'm delighted that we can be a part of it going out globally.
As healthcare has transformed to be a much more people-centric business, the technology changes. And so a lot of the shifts that you've seen in retail or you've seen in financial services, those technology shifts are now coming into healthcare.
We have to be about simplicity. We have to be about personalization. We have to be an organization that consumers look to and say, listen, I don't care where I go, but I hope you have United Healthcare as your insurance company.
An industry that's as old as healthcare, there's a lot of legacy technology. There are often times when the call center agent needs to flip between many different systems to view the results and get the answer to the member.
They are busy traversing the organizational challenges to get to the solution the other person on the phone wants. And so as a consumer, that's really driving a level of frustration.
And so United Healthcare needed a platform that allowed us to connect back into all of our legacy systems across the enterprise. What Salesforce gave us was a configurable platform with a well-defined set of APIs and integrations that allowed us to make those connections.
With the Salesforce platform, if somebody, say, called in and needed diabetic education, we're able to look up local pharmacies for them that service in diabetic supplies and home health agencies that come over, and we can set them up with programs to help hold their hand and guide them through those processes.
Our ability to use technology to enable our service personnel to have a real-life conversation, to establish a relationship with a consumer, it's a huge benefit to our service team and ultimately to our consumers.
It's really a one-stop shop. It acts as like an octopus, pulling all the information to where I had to pivot previously into one place. The non-interaction time that I have with members is pretty much eliminated. It puts us in a place where we are on their side. We're friends, we're here together. We're gonna go through this together.
They invest $1 billion in capabilities and in the product, and the cloud technology really gives us the ability to scale. It's efficient. It allows us to really focus on what we do best, which is helping members live healthier lives.
And to change somebody's life, to change somebody's day is just huge. It's so gratifying, and it's why I love doing what I do.
Technology allows and enables us to be our best version of ourselves at every level of the organization. So I think in that regard, we are trailblazers.
It allows us to give significantly greater individualized care with the right information for our members when they need it. So one of the things I get excited about when I think about what we've just built is I feel like we've just laid the foundation. We're just scratching the surface of what we can accomplish and what we can accomplish together with United Healthcare and with Salesforce.
So I'd like to bring up Mel and David to run through a great demo of the Health Cloud product. Mel.
Good afternoon, Sydney. I have the pleasure of taking you through our Makana Health Cloud demonstration this afternoon. And I'm going to start my day by logging in as Melinda Smith. Now, Melinda is one of our care coordinators at Makana Health, and she is responsible for looking after our more high-risk patients. Over here on her home screen, you can see all of the patients she is currently responsible for, including any new patients she may have been allocated recently. Melinda even has the ability to manage all of her patient tasks and activities to ensure that she's delivering the right care at the right time. Over here on the right, she's able to connect and collaborate directly with her patients. Now, Charles Green has been a patient of Melinda's for the last year. Charles currently has diabetes, but he's also about to undergo a hip replacement surgery. Melinda can see that she has an outstanding task for Charles, and she's able to access his record by clicking on his name. Over here on the left, you can see Charles's health record, which contains the most important information that Melinda needs to know about. It contains our objective clinical information that comes from Charles's medical records, like his conditions and allergies, as well as his more subjective engagement information, such as his desire to dance with his daughter at her wedding. Over in the middle, you can see all of our patient alerts, including all of our integrated EHR data. And on the far right-hand side, you can even see additional information such as cases that our contact center may be dealing with. By having a look at our health timeline, Melinda is able to see a chronological timeline of all of our engagement and clinical information, giving her a rich 360-degree view of Charles's history. Now, Melinda even has access to information from Charles's connected devices. Let's say, as an example, Melinda receives a call from Shauna, who happens to be Charles's wife. And Shauna is concerned about Charles's blood sugar levels. Right here in Health Cloud, Melinda is able to view Charles's blood glucose monitoring data and can indeed see there has been a spike in Charles's levels overnight. Now, Health Cloud gives us the ability to manage all of our care plans dynamically. This allows Melinda the opportunity to manage Charles's diabetes, as well as his transitional post-operative care requirements across both internal and external stakeholders. Right here, Melinda is able to view, update, or even add new tasks to Charles's care plans. And she's able to allocate these tasks out to other individuals who may be responsible for completing them. And she can see in real time how the team is making progress towards those. By having a look at our collaboration tab, Melinda can see the multidisciplinary team that is ultimately responsible for delivering to Charles's care. Here, she can see that Harry has been allocated as Charles's diabetes educator, and she can communicate directly with Harry in order to ensure that Charles has the information and education he needs to be an active stakeholder in his own care. Now, to take things one step higher, we can have a look at our household map. This allows Melinda the ability to engage and manage all of our internal and external stakeholders across all of our care plans. From here, Melinda can see the care team members that are a part of all of those care plans, as well as all of our household members, and she can see all of our external stakeholders who are also involved in Charles's health journey. This ensures that Melinda can contact the right person or right organisation at the right time to ensure that we are comprehensively delivering to Charles's care needs. Now, Melinda wants to make sure that she hasn't missed anything, and to do that, she's going to have a look at Charles's care gaps. This allows her to identify and prioritise additional tasks that can be added to Charles's care plans. These gaps are powered by Einstein Artificial Intelligence, as well as third-party analytics, which allow us to assess and add additional tasks to the right patient at the right time, thereby ensuring that Melinda is comprehensively delivering care to Charles. Melinda is even able to send Charles an integrated patient assessment. Now, this allows Melinda the opportunity to assess Charles's readiness in order to be able to be an active stakeholder in his own care. Charles's responses are synced right back into Health Cloud and allow Melinda actionable insights that she can then use to add additional tasks to Charles's care. But now that we've managed Charles internally, we want to ensure that we have the ability to engage and empower Charles. So back at home, Charles logs into his Makana Health patient community, which is his single hub to find everything he needs to know, become empowered and an engaged stakeholder in his own care. Here, on Charles's homepage, he can see any of his recommendations, as well as manage any of his tasks. He can even directly connect with all of his care team members. And he can even see messages around what it is he needs to do next. By accessing his My Health page, he can see all of the care plans that he has access to, including a timeline of his activities, and find more information around those people who make up his care team. Charles can even manage all of his outstanding and completed tasks. Now, based on the tasks that either Melinda or his doctors allocate to Charles to do, he's able to find articles that give him the information that he needs in order to become an empowered member in his care. This ensures that Charles can deal with any of the curves that his health journey may send him on. I'm now going to take a moment to introduce you to Barbara Brooks. Now, Barbara is Melinda's manager, and Barbara is ultimately responsible for the health metrics associated to the Makana Health experience. She's able to access our executive level dashboards where she can see in real time the various activities that her team is involved in. Here is an example. She can see all of our discharge and readmission information, and she's able to segment this information by either surgeon or facility as an example. This ensures that she can see trends and is able to make management decisions and changes in real time, thereby ensuring that she can deliver the right outcomes at the right time. And she's even able to access this information on her mobile device. And that brings me to the end of our Makana Health Cloud demonstration, where you've seen how Makana Health is delivering better outcomes to their connected patients. With that, I'll hand you back to Eric.
Thank you very much. Let's give it up for Mel and David. The SEs make Salesforce run, if anybody doesn't know. If it wasn't for the SEs, God knows what would happen. So I appreciate everything. Next, I'd like to bring up Martin Cox from... How are we doing? I know you didn't have the headset on. How are you?
Good, thanks.
So why don't you tell everyone a little bit about iMed Radiology and how you're utilizing Salesforce? Just kind of an overview of your business and service, and we'll go from there.
Sure. So iMed is a national provider of radiology services. So we have 200 clinics. Currently, it's a few different brands, so you may not know the iMed name, but at the end of this month, we'll be a single brand. So we're 200 clinics across Australia, all states and territories, and we have about 4,000 staff, 220 clinics, as I say, serviced by around about 400 radiologists. So we moved on to Salesforce about 9 months ago now, and the problem that we found with our existing system was it really wasn't giving us any insights, and it certainly wasn't being able to collect all of the data that was available to collect. And it was very difficult to reflect that data back to our service teams and to our customer care teams to make sure that that we could provide the right service and understand the services that we were providing.
So that's excellent. So in 9 months, how long was the initial project and to kind of get off the ground?
Look, we actually got it done pretty quickly. We needed to for various reasons. So we were probably up and running within about 4 months, and look, it was a little bit painful. For our staff, it was a big change, sure. Yeah, and because it was rushed on us, we probably didn't do it as well as we'd liked. But now that the platform has settled down and our staff have got used to it, and we're starting to bring in other aspects of Salesforce. So we've just recently signed into Einstein. So that we'll really be able to understand our data and be able to deliver that back to our customer relationship managers and give them the ability to have the right information at the right time. And I think that's really been our biggest gap. We've spent a lot of time on reports that have been very manual, Excel spreadsheets and all of the terrible things of the past. The ability to deliver the right information about individual clients in real time as somebody's walking into a clinic is hugely powerful for us, and I think what really gives us the opportunity to understand our clients better and to actually have those conversations that are meaningful to deliver our services and to meet the client needs.
So what was specifically the problem that you were trying to solve with Salesforce, initially?
Look, I think we historically hadn't ingested all of the information that we collected, as I say, and Salesforce gave us a platform to be able to take all of that information in, to be able to file it essentially into the database in a way that was accessible, and from that, there's just a multitude of things that you can do with it, right? So I guess the current adage is collect all of your data because you never know what's valuable until you need it.
Right.
So we've kind of taken that approach. Let's just
Sounds
take
like
everything.
my wife with shoes.
Yeah, exactly. Well, just, let's take everything in, and look, we've got some immediate things that we're focused on in terms of understanding our referrers as a group. We have approximately 80,000 referrers. It's impossible for us to go and visit all of those, even over a 10-year period. But with digital and with the evolving of health into the digital space, the means of being able to contact referrers and patients, for that matter, in the future for us through these other channels is Salesforce is the platform for us to be able to do that, and that's the exciting part. We can now express our services to a whole bunch of people that historically it's been impossible to do, other than sending them a letter in the post, and surprisingly sometimes that's still effective.
It is true still.
Yeah.
So how do you measure success, or how are you measuring success with the Salesforce platform? One, just from a we implemented the system and it's successful, but now going forward, what measures are you using to measure that?
Yeah, look, we're still on that journey. So we're currently in we're kind of retooling ourselves around, because we have Salesforce as a platform and the power of the analytics now. We've kind of gone backwards to our sales training program. That's a tailored program for our business.
Right.
We're looking at how that program fits into Salesforce and the metrics that we're expecting in terms of the customer relationship management team, so that they're reporting that into Salesforce. Mm-hmm. And then from that, we can gain insights on what those discussions that we're having with our referrers, in particular, what the outcomes of those are. And we've now got a tool where we can measure. We have an expectation around what the sales team do. We now have a tool that can report on what they've done, and then we can take insights from the effectiveness of that. And that's the exciting part, I think, of the next sort of 6 to 12 months for us, is to link our approach to the way we interact with our referrers, collecting that information, analysing it, and then understanding how we go forward to make those conversations that we have more valuable in the future.
Excellent. Now, have there been, with this new access to data, in a much more real-time fashion, have there been any insights that you gained that you didn't realize you were going to gain now that you kind of have pulled all this into the system?
Well, no, it's too early to say, Eric, at this point. There's 1,000 things running through our team's heads. There's 5 or 6 of us that are very excited about this. One of them sitting in the audience, and she's smiling. So we're itching to go, I think. I mean, that's and the sky is the limit, I think. The great thing about the Salesforce platform is, just staying contained and staying on a clear path for a time being, and then having a look outside. But I'm expecting that our sales team will have a significant amount of time returned to them. I think that will be the biggest win initially, because the analytics piece, which has historically been underdeveloped and difficult to do, is now going to be on their iPads or on their computer in front of them. It's going to be instantaneous. It's going to be a day old or 2 day old information. Right. So it's very current, and I think the power of that to allow them to have good conversations, but also to then be able to have more conversations and see more of our referrers and to really spread the message much more widely than we have in the past with the same number of people. It's hugely exciting.
Any thoughts of the future and kind of possible visions where you think that, obviously, as iMed's moving and expanding, where Salesforce may be able to help?
Yeah, so iMed as a business, we're very, very much focused on the digital space. And John, speaking earlier today, very much in line with the thinking that we have we've recentered the business around customer experience in the last year and a half, refreshed our vision and values around that, and really building out a full digital suite, online appointment bookings, patient portal, referrer portal, connecting that whole journey. And then Salesforce obviously sitting in there somewhere, collecting all of that information so that we actually understand the value of these things, and making at least the radiology part of an individual patient's health record accessible anywhere, anytime, is kind of, that's our vision. And in amongst that, radiology is a fantastic space to be in, because it's got a huge AI interest because it's pattern recognition effectively. So the ability to be able to leverage AI into our sector as a whole is it's a great time to be in health, I think, because we're in a transformation age in health, and there's a lot of work to be done, and it's very difficult to make wholesale change. I guess the great thing about IMED is, because of its size, it gives us the opportunity to really test out some of these things at a scale.
So one of the things I heard you mention as we're looking into the future and as healthcare is changing, obviously AI is a tremendous piece, but you mentioned something, obviously your workflow now is you're obviously getting results back to referring physicians and facilities, but you also talked about reaching out and having some contact with patients. Can you elaborate on how you see that expanding over some time?
Yeah, absolutely. So, historically, we've done the same as everyone, and, we've either sent out information in a PDF or we've just given information over the phone. And, with smartphones in almost everybody's hands, with notifications, with apps. So, we'll have a patient app shortly and a patient portal. The ability to be able to communicate with the patient pre-appointment and post-appointment, notify them of when their doctor's got their report. For instance, we take 30,000 calls a year, people just ringing up asking if their doctor's got their report or not.
Right.
Now, that sort of thing we can easily make go away just by having some simple notifications. So none of this is hard. It exists in a whole bunch of other industries, and I think the challenge for us is to actually have a go at it and get it to work and make the patient's journey and their access to their own information much easier than it has been historically.
That's excellent. Well, we're really excited to have you as customers in Trailblazers. Is there any final thoughts you'd like to leave us with?
Oh, look, just to say that I think it's incumbent upon us all to really work together to live the dream. The difficult thing about health is it's not a single industry. It's a vast number of different sections of health, and they all work independently and live independently, and somehow we've got to kind of join all those bits. And maybe my health record is it. I'm not sure, but we've all got to keep trying, because the benefits
move in the right direction. For sure,
the benefit to the patient is huge, right? So and ultimately that's what we're all here for, is better healthcare. So exciting times.
Excellent. Well, thank you so much.
Thank you.
So again, thank you so much for coming. I do have one question. I may be a little jet lagged. It's a little hot up here. I'm not sure. Am I the only person who sees a blue elephant? The mushrooms might be kicking in. Why don't you come on up? It's always fun when they say we're going to throw a blue elephant up on stage with you.
Hi guys, so my name's Sheree and I've got Bateria with me. Bateria is our mascot. I'm from Batir. We're a youth mental health organisation. We've got a stand over in the back that you might have come along to and made a mental health pledge today. We're right near the popcorn stand. So basically what we do is we run programs in schools and universities that are all about breaking down the stigma attached to mental health, and we take in young people that have a lived experience into the schools and universities who share their experiences with the crowd. So it's a really relatable message that we're getting across to the young people. They talk about their journey, so the hard times they went through, but always focusing on the positives of what helped them get through that. So we are a big promoter of all the mental health services out there, such as Lifeline, Headspace, and Lifeline. We find the biggest barrier in young people reaching out to these services is stigma. So by the power of sharing these lived experiences with young people breaks down that stigma and encourages them to reach out for support when needed, but also look after their mates. Traditionally, we've always run our programs face-to-face. We've reached over 170,000 young people now through our programs. All that has been face-to-face previously, up until last year, where we started to dabble in digital services. So one of the first big campaigns we ran was our IM campaign. That was through Facebook and social media, all about the power of story sharing and opening up to your peers and reaching out for help. We reached over 1 million young people through that campaign, but another really massive campaign that we launched is the first of its kind in Australia, and we actually moved out of the preventative space into the critical care, and we started working in hospitals. So we have a pilot project running at the moment in Hornsby Hospital, in the Child and Adolescent Mental Health Hospital, where we've created a program. It's a digital peer support program where a young person who has had a lived experience in hospitalisation for mental health shares what the journey was like for them. So what we've found is it's a really daunting and scary time when someone, especially if it's their first time as an inpatient. So we're sharing the story of what that journey was like for them. We're trying to break down the barriers between young people and the staff, so their care team. We're trying to get them to reach out and really open up a strong relationship early on, so they're making the most of that time within the hospital and they're getting the support they need. There's so much support in the hospital, but we find that the early stages, the young person's so scared and terrified of what that experience is like, what it's like if they're sharing, their deepest, darkest fears with someone. So we're really trying to break that down. It's a 3-stage series. So first of all, they're talking about the early admission. Then we've got another piece that looks at mid-admission when they've settled it a little bit. It's just talking through goal setting, how they can really work with their treating team to get the most out of that. And then they work towards discharge and what they should do for the ongoing management of their wellbeing once they've left hospital. So what we ask for you guys today, I suppose the biggest gap for us has always been as a young startup not-for-profit. We've struggled in technology department. We've recently migrated over to Lightning Field Services, which we're seeing tremendous results in. So if anyone in the crowd has really strong, skills that they could offer us, definitely come over and see us. We're over in a stand next to the popcorn stand. But something that everyone can do today is use this conference as an opportunity to have a conversation with someone here or someone at home, have a really meaningful conversation with someone and establish that connection. Ask them how their day was and find out what's going on for them, how you can support them and really look out for each other. Thanks, guys. Thanks, Eric.
Thank you very much. Thank you so much for attending, everyone. Have a great afternoon.